Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Matthew Janko, who is a cardiothoracic surgeon with Baptist Health, and he brought a patient, Miss Molly Berryman, with him. Thanks for coming in, guys. I appreciate it.
Thanks, Dr. Fox.
Now, we're going to talk about lung cancer, and in Kentucky, Dr. Janko, that's a big deal. Tell us about that.
Well, first of all, thanks, Dr. Fox, for bringing attention to this important topic. Lung cancer in Kentucky is a big deal. It's very important that we're all aware of how prevalent and how much lung cancer there is in Kentucky. Kentucky is the #1 state in the country for lung cancer, cancer deaths, and one of the lowest states in the country for life expectancy for that reason. So it's important for all of us to be thinking of this and how we can prevent it.
Well, now, you mentioned prevention. Don't live in Kentucky, I guess, would be one thing. But there are some risk factors, and if you have those, there's some screening methods that we can do.
That's exactly right, Dr. Fox. So I think we should live in Kentucky because it's a beautiful, wonderful, wonderful place to be. I really love living in Kentucky, but we have to be aware of those risks for lung cancer. And I want everybody to be aware of that and to help identify that and prevent it if possible. A big thing that we can do to prevent lung cancer is to avoid smoking or exposure to cigarettes and tobacco products. That's very easy to say, but incredibly hard to do. So it's important for patients to know that if they're over 50 years old and they have been smoking for 20 years, that they can get a very low cost or even free CAT scan to look for lung cancer and nodules in the lung that are suspicious. If we find on an x-ray or a CAT scan of the chest a lung nodule or anything that's suspicious for a lung cancer, we have very advanced ways of biopsying those masses and figuring out if they can hurt us.
Now, Molly, you've got to experience all this.
Yes.
Tell me your story a little bit, how it started out, and just walk me through it.
Well, I had to go have a CAT scan, and they found a mass, and I went to Dr. Janko. He had biopsy, and it turned out to be 3rd stage lung cancer. And I had the surgery, the robotic surgery. It was great. I mean, 2 months later, I'm here cancer-free.
Well, now, that's one of the reasons you are here, because apparently it's not as bad as you thought it was going to be.
No, absolutely not.
So tell me, what did you...
I was scared to death, the thoughts of it.
Was it hard? Was it hurt, or did you think it was going to be as easy as it was?
No, I didn't think it was, but it was great.
Okay. She mentioned robotics, Dr. Janko. Tell me a little bit about that.
So this is a new change in the way that we treat cancer. We have access to robotic hip surgery and also robotic lung and heart surgery as well. So what we do is we'll go in with even without an incision at all, through a breathing tube when the patient's asleep, and we'll take a biopsy using a robot to help it guide us and get a very good sample or biopsy of anything that's suspicious for cancer. Once we have a diagnosis of cancer, we can talk in our group of cancer doctors that are medical doctors and surgeons and radiation folks, come up with a good plan, and then, like Molly benefited from, taking medicine and surgery together to cure cancer through a robotic operation with an incision the size of your fingernail.
Well, Molly, how long were you in the hospital?
2 days.
And home, and you're getting back to your activities now?
Yes.
No big scars, and everything
No,
works
just
good?
A little small incision.
Okay.
I feel great now.
All right. Now, mention too, smoking, and Dr. Janko, you mentioned that. We were talking a little bit off the air. You said that maybe stopping smoking is actually harder than the surgery
Really?
itself.
Yeah.
But it is important. Are there any other risk factors, Dr. Janko, other than smoking, that people might want to consider for lung cancer?
Well, smoking in the state of Kentucky, or tobacco exposure and use, is certainly the biggest one. I think any family history of any cancer should make folks be really aware of their risk of cancer. Even if you've never smoked a single cigarette, being exposed to parents that smoked or secondhand smoke is a big deal. In addition to tobacco exposure and family history, there's also things in the environment that can cause cancer, radon in the ground and in the air, and that sort of the environmental exposure, toxins that we breathe in, folks that are exposed to coal. There are a lot of folks that are involved with coal mining in this state, and we thank them for that, for giving us the energy that we need. But that's one of those things that can put us at risk for having lung problems, so everybody needs to be aware of that.
If you have risk, there may be some symptoms, but there may not be. Now, Molly, did you have any symptoms that would say, oh, something's wrong here?
Not really. I was kind of short of breath.
Okay. Short of breath might be one, or there are others, Dr. Janko.
Absolutely. There are a lot of symptoms that patients can experience, but some people don't have any symptoms at all. Shortness of breath is certainly one of those symptoms. Difficulty breathing, coughing up, anything really, including especially blood, should be a red flag and make folks run to the doctor and say, hey, help me figure this out. What's going on here? Help me figure this out. Why am I having symptoms? Or if I'm over 50 years of age and have smoked for 20 years or something close to that, we need to take a moment and say, hey, I am at risk of having a lung cancer in a state that's where it's very, very common. And getting a painless test like a CAT scan can really save your life.
Absolutely.
Well, thank you guys coming in. Thank you for sharing your story. We appreciate it. And
Thanks,
if you're at risk and a smoker, get your CT scan. We'll be right back.